Hello, my name is Heather Myers, and I'm here today to speak to you about Strong for Surgery. Strong for Surgery is a program that was developed within the University of Washington to help optimize patients' health prior to surgery. Has anybody here ever had surgery? It's about 15 million Americans a year have surgery. The NSNH did a survey from 2006 to 2008. At that time, they reported 850,000 surgeries, and out of those 850,000 surgeries, 16,000 of them developed a surgical site infection. That's an estimated 1.9%. CMS, in the late 1990s, developed a program called SCIP, which SCIP is Surgical Care Improvement Process. The goal for CMS was to reduce that number from 1.9%, which was too high. All healthcare workers do not want to inject harm on the patient, but instead they want to make sure that they optimize the outcomes. Within SCIP, it developed different criteria that hospitals were required to monitor to ensure that they were meeting compliance. In turn, CMS actually reimbursed hospitals who were doing very well. So if you got in between the 90s and 100%, you got 100% reimbursement from CMS. The program involved antibiotic treatment, pneumothermia, which is keeping normal body temperature even whenever you're under an operation, beta blockers, and a few other type of initiatives that they had sponsored. The problem was they initiated that in the late 1990s, and to date, there has not been any impact whatsoever on surgical site infections. So, SCOPE, which is the Surgical Care and Outcome Assessment Program, had actually partnered up with CERTAIN, which is part of Washington University, over in Washington State. And what they decided was that we cannot start to treat patients once they hit the hospital doors. We have to optimize their health before they come through our doors. We have to make sure that patients are at their most healthiest in order to have surgery and reduce surgical site infections. CERTAIN initiated this in 2013. In conjunction with SCOPE, they started to monitor their outcomes. They worked on a total of 4 measures. Those measures were diabetes, smoking, nutrition, and hyperglycemia, controlling hyperglycemia, or diabetes, as known in the population. Within those 4 measures, what they found throughout research and study with the American Nutrition and Dietitian Association, that anybody who had an albumin level less than 3 was at very high risk for having a surgical site infection. So what they started to do was track people for gastrointestinal disease, weight loss, and any other type of nutritional disorder that might help to reduce their albumin. While they tracked that information, they started to provide actually a Nestle product, which increased the patient's absorption, also increased the albumin, and reduced the risk of surgical site infection. Nutrition is the easiest of all of the measures for an independent person to influence to make sure that their outcomes are improved. As for diabetes, the Association of Diabetes across America, or the American Diabetic Association, as it's otherwise known, has also felt that there's a very high prevalence of people out there every day who do not know they have diabetes. When SCOPE and CERTAIN started to research, 1 in 3 people who they went and tested prior to surgery were diabetic, but did not know they were diabetic. That's extremely high. So they would cancel the surgeries. They would actually monitor the patient's glucoses. They would treat them for that, optimize their blood sugars for a period of 30 days, and again, reduce the risk of surgical site infection. Smoking. Screening the patients beforehand, Strong for Surgery helps the physician to optimize the patient's health and reduce the level of surgical site infections. Since Strong for Surgery has been initiated in 2013, Washington State University has reduced their surgical site infections to less than 1%, well below the national average. This is a very strong indicator that Strong for Surgery would be a successful program if rolled out nationally. Thank you very much for your attention this evening. Thank you for allowing me to explain Strong for Surgery. I'd like to open it up for any questions at this point in time. No questions. Wonderful. This concludes our